What's up, warriors? It's me. I am sliding back in to kind of give you guys a glimpse at my HS survival kit. HS Hidradenitis Suppurativa. It's a extraordinarily unpleasant. Man, that word doesn't even touch it. It is a rude, horrible condition that causes abscesses in the skin, in areas such as under the armpits, under the breasts, in the groin, in the buttock area. You can get abscesses that range in size. I think I've had an abscess in an area that has been about the size of a grapefruit before. This surgery can require long-term infusions, surgical intervention, antibiotic long-term therapy, steroid, a lot of different things go into this very difficult, hard condition that I have and that I am living with and I am living out loud with. But yeah, so I'm here to kind of just show you what is in my HS survival kit that I have all the time. So one of the things that I definitely know a lot of HS warriors use, again, let's say this is not medical advice. This is me sharing you what I do to survive. So if it works for you, it works for you. If it doesn't work for you, then let's just keep trying, keep fighting until we find what does work for us, because every HS warrior is different and body responds to different things in different ways. And we don't shame, we don't make someone feel down because it didn't work for us. Just understand that that can be that rage, that pain that's inside and causing you to be a little negative. But positive mindset required is the name of my swag here. So let's continue to uplift, and again, things that are in my HS survival kit. So my light's really bright. So this is Vicks Vapor Rub, and specifically this is the lavender because the methanol that's in it is pretty little powerful. So I enjoy having the little calming lavender scent that goes with this Vicks. So the Vicks, you're not going to want to use this on anything that is open by any means, but this can help calm a abscess down. This particular formula also has a topical analgesic in it, which is a numbing agent. So that helps when you're just in a flare anyway. Some of the times the methanol can help bring an abscess to where it's able to open up. But again, the topical analgesic in this plus the lavender, this Vicks particular is a winner for me. So I definitely always have HS teammates with that with that the Vicks in their survival kits. I also use something specifically when there is an abscess that's just, I feel it right under the skin. I feel that it wants to start. And if I can be calm enough and be in tune enough with my body to pay attention, I am going to grab this that's called Domaburo. So I'm covering the bottom because it has some of my information in it. Domaburo, this can be found in Walgreens, CVS. Again, no advertising for anything, anyone. I'm just showing you what works for me. So this is the major active ingredient is aluminum sulfate. It's astringent. It dries things up. So with this, I'll just open this pack. It's a powder pack, the small pack. So this is actually 2 packs here. I'll cut them in half. And so again, within my kit, what I'm gonna always have in my home is when I have some type of gauze. So I would take the gauze and I would run it under very warm water, and then I would take the pack, cut it open, and I'm going to shake a bit of the Domaburo onto this gauze. I'm going to rub it through the water. I'm going to squeeze it. I'm going to spread the powder out across it while this is soaked in warm water, and then I'm going to apply it to where I feel like that abscess is coming. And I'm gonna use some little tape again that I keep in my kit. This is a soft conforming tape. So, and this particular tape actually can rip off in sections. It rips pretty easy. So if I were to take and apply however I'm covering, I could cover the entire gauze to give it a bit of I think my light is too bright. Let me see if I can turn it down. Maybe if I go one level down. So I can go all the way across with this to give it an extra layer, so it's not so much of the warm water is touching my clothing or skin, etc. But then I'm just gonna take that and tape it down to my skin, going all the way across to lock it in over the wound. So wherever, however, and then I'll use this, just showing this tape, but this tape, if you put it down nice and taut, so I'll go this way, we can get some movement to the skin. So I like a tape with a bit of movement just because of the areas that it might be in, taping it down and being able to move and protecting the clothing. Love this conforming tape, dermal burrow, for when it's the astringent soak, astringent compress. You can call it that, an astringent compress. As soon as you feel like an abscess is starting to come up, grab that, put that on there. And I have definitely avoided some flares, especially since I love to travel. But you must be paying attention to it and get it as soon as you start to feel anything below the surface. Another one, this is prescription based, but this is another one. It's a Retin-A. They can come in a cream or a gel, tretinoin. But Retin-A cream, this is prescription only. Again, this is something that will dry it up. You need to be careful in sunlight if you have this prescription, if you're using this on it, definitely be careful out in sunlight. But I'll put this on it, and again, not being able to keep the abscess, not to be able to come up and become so painful. So Vicks, Retin-A, dermal burrow, all those things helping before it comes to a place to where we can't walk, we can't lift our arm, can't move, all those things. I received a prescription for this. This is a benzoyl peroxide. I've had very minimal. Again, this is a drying agent for the skin. It works for you. This worked for me for a time, maybe early on. I guess I would be considered stage 3 in my HS, severe cases. With all the tunneling, we'll talk about how they classify that at another time. But again, back to my survival kit. This doesn't really have such a major helping effect on me. That Retin-A does much better for me, or the dermal burrow astringent soak compress helps me much more with that. So some of the things, and of course, everybody loves a good Epsom salt soak. If it's starting to come up, you're noticing it, or if it's at the place where you want it to increase the warm compress so that it can come and the abscess can open up. So that's something that a lot of people swear, the physicians encourage you to do, the warm compress. So if I have an open wound, I am going to use my betadine to help with cleanliness. I wouldn't encourage anyone to open up their abscess themselves, but I know that many of us, and it's hard for people to understand that you could be in so much pain that you will take a scalpel, do all the proper cleaning methods, and clean the skin, and turn your bathroom into a OR. People don't understand the level of pain when the abscess is pushing directly on to a nerve and you can barely breathe without excruciating pain. But don't encourage that, but understand that some HS warriors, they are warriors on that level to where they do it and they have to do it. And not even gonna lie, I have medical background, medical expertise within as being a certified athletic trainer. So yes, I have, but definitely don't recommend it because you are exposing yourself to a high level of infection from the surroundings, from because it's not an OR, it's not a clean space. Um, but we do the best that we can. So betadine for open wounds, clean it out. I don't have it. I'm out right now. It's a wash called Vash, VASHE, Vash. Lot less damaging on the exposed tissue if you have an open wound post surgical, fresh. I've also used wound cleansers, peroxide, hydrogen peroxide, a little bit of the research and different things on that. It can do some other different things to the skin. So if you have it to clean, that's all you have to clean. You use you want. But actually, purified water, still water, is maybe a little bit better than peroxide. But do it works and feels good for your skin. But I have wound cleansers, betadine. I also have, listen, I've lots of surgery, and I'm still right now post-surgical. So I had a surgery maybe about 5 days ago. So timeline dependable, but maybe not 5 days ago, further out than five. Anyway, so I'll get the sodium chloride big things to use as well, to help with a cleaning, as well as I'll skip if I have some other things in mind. I'll come back to that. But for large, huge open wounds, tertiary healing, I would your physician, your wound care clinic, a wet to dry dressing in those early painful stages is important. So I will use, we have the Curlex. Curlex is one that helps so wounds can really range in size. You go in, what you see on the surface is definitely, it may not be what is happening underneath the surface. Like an iceberg, you just see the tip of it. But once you open it up, once the surgeons get in there and can really see and move around without you being in excruciating pain, the tunneling, the different tracks, you may come out of the surgery with a lot open. And it's not to scare you, but once they do it, you can heal from the inside out and get better. So I'm just gonna show my little dressing here. So the Curlex, just so you guys can maybe know what to ask for from your physician. Post-surgical, this literally, of course, you're gonna always want to use your gloves to protect yourself against the germs. If you clean your hands well prior to doing any of your wound care. But I'll take this, and I use Lister scissors. Those are my favorite. They have a little bend in them. I didn't bring any right now, but I may just do a post-surgical packing video if you guys want me to. But again, using this, pour the sodium chloride onto it, get it nice and wet. You can squeeze some of the excess water out, and then you're just going to pack it down into your wound, layer it, depending on the depth of it. And then I use a abdominal dressing to help, again, protect my clothing, protect different things around it as I'm doing a wet to dry dressing. So you'll wet, then you cut, and then dry. Curlex on top. Everything that is touching the skin, I would highly encourage that it is absolutely wet. Then you'll come in with an abdominal pad coming over. Use more than one. I've absolutely had a wound where I've had to use this plus another one just to cover the length of the wound. And then again, the soft moldable tape that conforms to the body. I may go over the entire, I'm not going to waste all the tape now, but I may go over the entire abdominal pad just for support. The compression over that wound will allow you to be able to move better. A little compression. I've been threatened with vacuum wounds, but a lot of the areas that we have in the groin, in the crux, in the axillary, the armpit, the wound vac is you got to stay still. It's a hard place or it'll lose the seal. So I have never had a wound vac because all of the areas that I've had that needed the wound vac, needed the skin graft, it was in an area to where they were like, it's not going to be successful. So I didn't do the wound vac. So I'll toss these items over. With some of the gels and the different things that I showed you, I encourage you to use cotton tip applicators, as to, especially if you're not using gloves, just for another level of cleanliness, not transferring bacteria, cross contamination. So I'll grab whatever item that I'm using, whether it's the Retin-A, I'll bring this one back because I prefer this one, and using this one to apply it, and then of course trashing, using the gloves, etc. Another form with the sodium chloride, this is just another way to, if you're trying to remove that dressing, and you've gone a little bit longer and the wet to dry, the area that was wet has started to kind of dry and adhere to the inside of that wound, and you've got a wound care. Maybe my HS survival kit has turned into a wound care because I'm having a little bit of PTSD with that, but you may need to saturate that on the way coming out. So distracted as always. Manuka honey. We see it maybe a little bit. The Manuka honey. Use this again. Keep it in my HS survival kit. I use this. I'll use honey with wounds that have started to close, not post-surgical size wounds, but weeping wounds, or wounds that I am trying to get to close. Honey only on the wound, not on the healthy skin. No honey on the healthy skin. Honey only on the damaged skin. They have something called Meta honey. I am out of that. So Meta honey is something that you can sell. Manuka honey has a higher level of the little things that help the skin heal. Manuka honey is fairly pricey, but I've noticed it, and someone told me about it. I tried it. I've had success with it. I've also had success, but well, who knows if it was just time for it to open or if the honey helped it open. But I use honey more for healing than for opening. I tend to talk fast when I get excited. This is a Manuka oil that I have as well. Lots of different things. HS warriors, be mindful, be careful. A lot of people, we get desperate because of our level of pain, but do your research. Don't let people just sell you anything. Check in with a support network if you have it. The different Facebook groups that are out there. Tap in with other HS warriors. Tap in at the bottom of here. And yeah, this has no label, which means that it probably has CBD in it, anti-inflammatory, the cannabinoid system, etc., whatever. Again, I've paid for a lot of different things just because we get desperate. Anything that will help me, I'm willing to take it. From a preventative standpoint, I haven't used these consistent, but these are clear skin acne prevention patches. Patch-Aid has a lot of different vitamins in it. I suck at taking pills. Zinc can make me nauseated, but I do have it. It's definitely in my kit, but I think I'm going to do another video, keep these a little shorter, with the herbal different things, the natural different things that I use outside of these, because what I'm showing you today are just kind of westernized different things. Clindamycin phosphate lotion, preventative. If you have found that higher level of bacteria on your body, then this can help keep it down. Using an antibacterial soap, just if you have an overgrowth of bacteria on different parts of your body, the clindamycin phosphate lotion, of course this is prescription only, will help, or using those antibacterial soap. But just know that this is not a condition that has anything to do with your level of hygiene. that has nothing to do with this condition. Hygiene, good hygiene, period, will absolutely help in anything with life, right? We just came through with anything viral, anything bacterial. Of course, good hygiene is going to help, but this is a auto-inflammatory condition that has nothing to do with your hygiene. So warriors know that, HS warriors know that has nothing to do with your hygiene. Of course, this condition affects your sweat glands. So I love to work out. I love to be outside. I love to hike. But of course, the more I work out, the more that this condition can inflame. So we do as much as we can to protect ourselves and live the life that we want to live. So I have been bigger than this and have this condition. When I was diagnosed with this condition, I was in peak condition in AIT. So in my military school, specific school training, is when I first experienced this condition. Story for another day. But I was in peak physical condition. But you know it was at an all-time high for me at that level of my good 17-year-old, 18-year-old life? Stress. My stress was at an all-time high. And I won't even pretend and say that I knew how to manage that. I did the best that I could with the information that I had. And yeah, water, staying hydrated as much as you can. Do that. Flushing the body, great stuff. Definitely you'll hear that smoking will have some negative effects. Listen, if you're still smoking, that's not the only negative effect, right? With that, but neither here nor there. We're not going to shame for anybody that's having that struggle and trying to kick that. But yes, your body will heal better regardless of what it is if you're able to stop smoking. Data-driven, research-driven. If you can stop smoking, your body can heal some of these wounds better if you're struggling to close them. With that, is there anything else pressing that I wanted to show on my kit? Just really quick, this is a first aid antiseptic spray. More than anything, I use it as a pain relieving spray. Should have led with this one. When it's going and nothing is working because my stress level is too high. I've eaten some of my trigger foods, whatever. When absolutely nothing, pain, just spray. I'm spraying it. If it's in an area where it's safe to apply it. All of this stuff is external use only. Whatever, solar cane, I get it. Some cooling aloe, lidocaine in the 2 prescription lidocaine. And I've tried, sometimes you try all of those things and it doesn't work. Ooh, y'all were gonna fuss me out. Prid. Every HS word. This is Prid is a all natural drawing salve. If you just want it to open up, if you've got the time to be at home and lay it bed and not go to work and just get it to draw, you're gonna have the warm compress, the Prid. These things will help draw it to it. I hope I am not going too fast, and I hope I did enough. What else? I've got things. Oh, this burn spray. Yep, this helps. It has a lidocaine in it too. I'll just be honest with you. Anything that has a good lidocaine in it, protecting the skin. I do have hydrocolloid dressing. With that, I do have some Tagaderm as well. These are just different things that I use to help protect my clothing. A petroleum dressing. So on some of the very, very deep wounds that I have, on the outer layers to help it not drying out and adhering to my skin so much. Like all of these things, definitely run them past your physician, your medical care professional prior to you trying them, using them. Chat with other HS warriors that you know, that you have a support system. A support system is going to be extraordinarily important. I haven't always had I haven't always used my support system. I have not always allowed the level of vulnerability. But in this space, I am. I desire it. And outside of that, I lean and I leave you with. Today is a blessed Tuesday. Who knows when you're watching this? So for today, I leave you with this affirmation. If you choose to say it with me, after me, listen to it. However, just speaking it out, it assists me. So today I speak that I have purpose, even when I don't always know what it is. I promise to show up right where I am and give it my all. I have purpose even when I don't always know what it is. And I promise to show up right where I am and give it my all. I am allowed to take up space. I am needed in the earth. I no longer dim my light or downplay myself to make others comfortable. That's so important. I am allowed to take up space. I am needed in the earth. I no longer dim my light or downplay myself to make others comfortable. I am honest with myself. I am patient with myself. Oh, please, warriors, have grace with yourself. Be patient with yourself as I learn to be more patient with myself. I give myself grace and compassion. I allow myself to feel and be human. I am disciplined. I show myself the strongest form of self-love when I stay focused and disciplined, and I deserve that. Warriors, show yourself grace. This is my HF survival kit. Wound care gone long, but love and light, peace and blessings. Let's keep going.